Thank you, Acting Deputy Speaker. I rise, of course, to support the Coalition Government's election commitment to increase the income thresholds for eligibility to the Commonwealth Seniors Healthcare Card. And it was a great day in the campaign when we announced this, and not that big a surprise when the Labor Party dramatically and rapidly said, "Oh, well, we'll do that as well." And this, of course, it changes the eligibility income thresholds to $90,000 adjusted taxable income and, for singles, and $144,000 for couples. So it's a dramatic increase in eligibility, and I think around 50,000 or nearly 50,000 people is estimated will now be eligible for the Commonwealth Seniors Healthcare Card. And these people are the great economic heroes of our country, self-funded retirees who have been in a position to finance largely their own retirement, and they take an enormous burden off the taxpayer, of course, by way of funding their retirement rather than needing to draw on the appropriate supports that are in place for senior Australians who are eligible. But the Commonwealth Seniors Healthcare Card is an important indication. It's a practical support. It's one that they deserve, but it also indicates to them that we do value the fact that they've provisioned for their retirement, and that they do, despite having provisioned for their retirement, deserve some support from the government. The last few years have been have been challenging for all, but particularly for self-funded retirees, given the economic turmoil and headwinds around the pandemic. And certainly I have a very significant cohort of self-funded retirees in my electorate of Sturt, and a lot of them were very apprehensive about their financial circumstance. Obviously, there were dramatic issues happening in markets with their investments that they rely on to provide for their retirement out of their own savings. And this is an excellent way of making sure they understand how much we value them, and that they should be entitled to support like you can receive through the Commonwealth Seniors Healthcare Card, obviously around pharmaceutical and medical benefits. It's worth noting, of course, that the Commonwealth Seniors Healthcare Card is also used by state governments and others to provide concessions, etc., to seniors. I know that's the case in South Australia, and I'm sure it is in most, if not all, other jurisdictions. So being eligible for the Commonwealth Seniors Healthcare Card not only gives you access to these medical and pharmaceutical entitlements through the Commonwealth, but of course there are other concessions that can be accessed through state and territory governments and local governments, so it's very important. It's disappointing that Labor have broken their promise to introduce this by the 1st of July. That, I'm sure, is particularly due to the delay in the Parliament sitting, which was ridiculous. I apologise to all the self-funded retirees who have missed out on a fair access to this card from the 1st of July, but I'm pleased that this bill hopefully will rapidly move through this House and the Senate. We can adopt it and we can give that entitlement to all of them. I commend the bill to the House.